Hi, Dr. Frega here with Ideal Health and Wellness, and this week I am 37 weeks pregnant. So I wanted to talk about something that I commonly get referred around that 36, 37 week mark from other OBs and midwives, which is a baby who has breech presentation. So breech presentation means that either the buttocks or foot is present near the vaginal canal instead of the head. So usually around 32 weeks, this is babies can be breech in up to 16% of pregnancies. By that 36, 37, babies that are breech, about 25% of them will remain breech. So there's a variety of different reasons why babies are breech. Some involve maternal reasons, other are fetal. So with the mom, again, there could be an issue with the placenta, where that's located. It could be shape of the uterus. If she has a history of uterine fibroids, again, that could be another reason why baby is in the position that he or she is. The umbilical cord could also be short. In babies, there's conditions like hydrocephalus. That could be the reason why they are. And some causes are just unknown. So a lot of what we see in our practice has to do with more tension through the abdomen and the pelvis region. So most babies I've been able to get to flip, and I always say if they don't flip, again, it's usually a reason there's something going on with mom or baby. And usually that comes out after birth is when we find out why. Again, there's a variety of different ways we use to treat that. I did talk earlier in this pregnancy series about using chiropractic, specifically chiropractors train in Webster. And although that's not a treatment for breech, it is preventative because we're keeping, again, that pelvis, the muscles, the ligaments, we're keeping that kind of health there to help when baby kind of is moving and growing, that they're going to go into an optimal position. So in women who've received, I think, chiropractic care, again, in my opinion, and looking at, I guess, my patient population, I don't know if I really had anybody who has had a breech presentation that's gotten regular care. The other thing that I see as common is women who aren't very active during their pregnancy. Again, they have a lot more tension through the abdomen and the pelvis that restricts movement for babies. Another common thing is if there are siblings, mom who's had to carry a sibling and then she's favoring one side over the other, that can also create an imbalance, which can contribute to the breech presentation. So I definitely believe in getting chiropractic throughout your pregnancy to help prevent this. Now, again, even if you have a breech baby at 36 weeks, that baby still can flip at any time. There are some doctors that will deliver breech babies. That's kind of getting few and far between though. What they'll also try too with your provider, if babies still breech around 37, 38 weeks, they can do an external cephalic inversion where they'll do a manual transabdominal inversion of the baby to help get the baby to go head down. I would say the most successful thing that I've had in my practice is using acupuncture. Now, I typically don't needle because what's been shown is actually the use of moxibustion, which is a Chinese herb, over the point is more effective than actually using the needles. However, again, I have done needles, and sometimes I'll do a combination. But again, I usually always go towards moxibustion. And I can do that in office, but I will also send mom home. This is a moxibustion stick that you would light at the end, and you would apply over the bladder 67 point. And again, we instruct all the patients how to do that because you are dealing with fire, so how to prop that up. Mom can either hold it, or somebody else could hold it for her, but there's ways, again, that you can prop it up so mom can lay back and relax during the treatment. So it is recommended when we use the moxibustion is to do that for 10 to 20 minutes at a time, and do that for twice a day. Now, again, we say it can take 7 to 10 days. I typically see babies flip within a few days, though. So again, research has really shown good success rates with the moxibustion herb for flipping babies and helping with that. So, and I would agree. But again, chiropractic care throughout your pregnancy, I believe, is really helpful, kind of addressing any musculoskeletal issues, staying active, limiting carrying the younger siblings, also all very helpful in helping with preventing breech as well as treating breech.